My name is Sue Dempsey, and I'm a licensed clinical social worker. And I've been in the field of mental health counseling for about 30 years. I'm currently in private practice. I've been in private practice for 11 years. And prior to that, I was a school counselor, and prior to that, I worked in a psychiatric hospital for 10 years.
This is Sue Dempsey. She is a friend and client of my mother's, and we are going to talk about catatonic and residual type schizophrenia today. Okay, so to start off, we're going to start off with catatonic type, and what are some characteristics of catatonic type schizophrenia?
So when you see someone who is catatonic, what you see is a significant reduction in activity, very dramatic, and the voluntary movement stops. Activity can increase what they then call catatonic excitement, but mostly it's almost like a statue. When you look at that person, there is very, very little movement.
Okay, so are there any secondary medical side effects of catatonic schizophrenia?
Well, I would say that there probably would be. The one catatonic patient, actually, when I was in the psychiatric hospital that I worked with, was resistant to eating, and so that person could become malnourished, and I would just think that it would affect their overall health.
Okay. What causes catatonic schizophrenia, or is there a known cause?
I'm not really sure in terms of the different types of schizophrenia. I think there are 4 types, but schizophrenia in general, they look mostly at genetics, but they also are saying that environmental factors play a part in causing schizophrenia, meaning that in infancy, that infant might have been deprived of oxygen or might have been malnourished. Or they also say that the family dynamics could play a role, that there might have been some very serious psychosocial stressors that could cause schizophrenia. Too.
Okay, so what are some common treatments for catatonic type schizophrenia?
So in the 80s, when I worked in the psychiatric hospital, the most common form of treatment would have been electric shock therapy to change the brain waves, to change what was going on within the brain. I believe they still use electric shock therapy, but I think most commonly it's more antipsychotic medications that would bring that person out of that.
Do you think that catatonic schizophrenia can be prevented if it's caught in the early stages of the disorder?
I would imagine that it would. I'm not sure how rapid the onset of that episode is, but I do believe, and I have read and researched, that if you can find treatment for that individual prior to a severe episode, that you can reduce the severity of the episode.
When a patient holds a position or facial expression, do they experience discomfort or are they numb to all sensations?
That's a really good question. I'm not sure I knew the answer to that. I can tell you that the one patient that I worked with looked very severely depressed. So I'm not really sure of that answer, but that is a very good question. I think that they are in such a deep state of depression that they may be numb. That would be my guess.
Moving on to residual type schizophrenia, without further ado, what characterizes residual type schizophrenia?
So I believe that residual schizophrenia is when that person is not experiencing any psychotic or hallucinations and is not in the acute phase, but that doesn't necessarily mean that they're cured. They may be in what we call remission, but really most people that have schizophrenia wax and wane with their symptoms, meaning that they kind of come and they kind of go, and we have to be prepared for the worst.
Once a person has schizophrenia and the symptoms go away, is schizophrenia considered cured or in a residual state?
I would say in a residual state, or really just getting good treatment. Good treatment meaning that they are responding to medication and also perhaps psychotherapy. And the psychotherapy is treating kind of the byproduct of the schizophrenia, which means the difficulty with socialization, the difficulty in functioning, the difficulty with employment, and psychotherapy works on socialization and those kinds of things.
Is medication necessary for the treatment of residual type schizophrenia?
I would say yes. I think when we talk about residual schizophrenia, you've had a psychotic episode in the last year. I'm not really sure if you would want to wait for those, the hallucinations or the delusions to occur to treat that, or if you do preventive treatment. I'm not really sure. That's a good question. We might want to further examine that one.
Okay. And can a person start having symptoms of schizophrenia again after they've reached a residual state?
Yes, absolutely. Because really, it's like I said, the symptoms wax and wane. So just because you haven't had one in a while doesn't mean you're never going to have the symptoms again.
Okay. And do you have anything to add that you think would be necessary for the class to hear about residual or catatonic type schizophrenia?
I think I would just say that it's a really sad diagnosis. That it is important to get treatment because you really want that person to have less suffering. I've seen a lot of people who've had psychosis and hallucinations, and it's just very sad to watch them experience those symptoms. And there's a definite significant impact on family members who have a loved one that has schizophrenia. It impacts everybody. So I just think it's a sad diagnosis, and you really treatment is imperative.
Okay. Well, thank you very much.
Thank you.